We have the Minister of State for Health and Social Welfare, Dr. Tunji Alausa, joining us now in the studio. Thank you so much for joining us. Good to see you on Newsnight. Well, let's start by talking about this administration's vision for health and what this health sector committee that you've just set up, 13-member committee, how is it going to, change the game in Nigeria's health sector?
Thank you, Ngozi. As part of our agenda, following what, latching on Mr. President Bola Ahmed Tinubu 9-point agenda, we at the Ministry of Health came up with 4 pillars on what we have to do to help restructure the healthcare system in the country in a sustainable manner, decades to come from now. The first pillar was its governance. Second pillar, improving our population health outcome. And the third pillar, unlocking the value, unlocking a healthcare system so that our healthcare sector moves from being a consuming part of the economy to a more productive part of the economy, where we can use the healthcare sector to generate jobs, hundreds of thousands of jobs. And of course, the fourth pillar is looking at health beyond physical security, but more as social security and national security. Now, let me come to the first pillar, governance. That's why we quickly moved to inaugurate a National Health Research Ethics Committee yesterday of about 14 members. This is because we're putting a lot of emphasis on integrity, where Nigerians are going to be respected and not going to be taken advantage of in any form of health research. And we're using that to also mobilize as part of the cross-cutting enablers in bringing more revenue into our country, where we can get more clinical trials. International companies are coming, they want to do clinical trials. Remember, these drugs are being, they go in clinical trials. We have a population of 220 million people. We're black population, we have a genetics predisposition to diseases and what medication works well. We should also be part of this clinical trial so that we can know the adverse effects of this medication, the ones that work better for us as black people. But then, prior to this, we don't have a functional ethics research committee that will sign off on these clinical trials before they can get to market, so that we can do phase 3 clinical trials where we can begin to see the benefit and the adverse effects of this medication. So we've quickly moved to do that, more so that we can also open or give opportunities to young Nigerians to participate in these trials, researchers, and the other spin-off opportunities that will come. So, well, it's more, but the primary motive is because we're following the president's footsteps. We have to maintain honesty in everything we do.
And listening to you now, what readily comes to mind is the expertise, the professionals. We had this conversation just before Christmas then, and our research institute. So what are you doing, 2 ways now, to ensure that these brains within the country remain with us to help ensure that this succeeds, and our different research institutes?
Very good. Thank you, Suleiman. On January 4th of this year, we constituted the National Health Research Committee. That's the committee that has been mandated as part of our National Health Act of 2014 to midwife research in our country. So that committee was carefully chosen. We have about 13-member committees. We chose very accomplished Nigerians, both here and abroad. A very accomplished oncologist who is big in America on translational research, Professor Olapade, agreed to chair the committee. So what we're doing with that is we're going to, the committee will help to unlock the opportunities in research. Bring in they will develop a database where all research that's available all over the world, it will be there. They will train our researchers on how to write grants. As they're being trained on how to write grants, so when they write this grant, they can actually get opportunity to bring in grant dollars into the country. We're hoping that 1 year from now, we'll be able to mobilize up to $500 million in grants. Okay. And then when we want sustainability, so what we've done with 2 of our major research centers, the National Medical Research Institute, NIMA, and the National Institute of Pharmaceutical Research and Pharmaceutical Research and Development. We've mandated them to start doing postdoctoral fellowship. Each of those research institutes would admit in the first year 200 postdoctoral fellows, postdoc fellow. In the first year, both will have about 400 postdoc fellows. It's going to be a 4-year program. So fast forward 4 years from now, we'll have about 2,000 postdoc fellows. So that these fellows will be properly trained on how to put research proposal together, how to put grant writing proposal together, and it will be self-funding. They will get paid out of the research grant they get, decent, good salary. Then you now begin to unleash innate potential of young Nigerians, young researchers, to now develop, innovate, and so we can begin to actually develop our healthcare sector the way it should be. Without research, we cannot develop our healthcare sector.
Absolutely. I mean, you're very spot on. Without research, how far can we really go? And I'm wondering, what will be the scope of this research? Alternative medicine has really, taken a back burner in Nigeria for so many years, and every now and again you see some bright lights. I won't begin to name them now, who have done research on their own, self-sponsored, without any support from government, whether you're talking about HIV/AIDS, malaria, and what have you. In fact, let me just give you this. My mother would swear on lemongrass, for example. She'll tell you, look, it takes care of malaria. Are we looking in that direction, as with this research, on how to address HIV, malaria, tuberculosis, and all the other ailments that Nigerians, have to tackle?
Of course, we're looking at everything. Right. Now, we want a coordinated, we want things to be better coordinated. And I'm going to talk a little bit on the traditional medicine now, what we're doing with that. But let's talk about general research itself. We are going to now go back to the basics. Basic research, translational research, and clinical research. We would do everything. We're mobilizing. We have professors scattered all around the country in our teaching hospitals, in our universities. So we're creating an enabling environment for them to thrive. So we will do the conventional research. Now, coming to the traditional, we're endowed with a lot of herbal medication and a lot of things. People come in, I understand people come in, oh, I've found cure for HIV, I've found cure for this. We cannot just take that as face value. There's something called double-blinded clinical trials where people are randomized into placebo and active drug itself. So that's what we'll be doing with that. We begin a collaboration between our National Institute of Pharmaceutical Research and Development Institute and the Department of Traditional and Complementary Medicine. I've mandated both to work together because that's where we can now begin to check for the active components of a lot of this herbal medication, test them, make sure what it's said to contain, they actually contain those active ingredients, and then we can now roll that out in a more coordinated way to do research and actually see if it works. And if it works, then we can begin to spin off industry around it. And that's what we...
I like, sorry to cut you, Dr. Alausa, because I think if you look carefully, that's one of the reasons some people have started looking towards the Far East, talking about the Asian countries, phytomedicine, and we have them here. And I'm happy that you're already looking to doing that with the scientists and researchers we have here in the country. But again, let's talk about another aspect that should also worry you, and because it's affecting a lot of Nigerians, and it has to do with the high cost of medicines. Because some pharmaceutical companies are leaving the country to the extent that some ailments that people ordinarily would manage can't be managed anymore. So how does this come before your ministry?
Yeah, thank you so much. The president is very distressed about this. And it's commitment, President Bola Ahmed Tinubu, healthcare sector is committed to revamping this sector in an awesome manner, and it's where it becomes sustainable into the future. About this pharmaceutical, the problem we have with the pharmaceutical supply, drugs, medical consumable today. At the last Federal Executive Council meeting, the president actually made us, we spend more time discussing the interventions we're going to put in place so that Nigerians can have succor from this. And what the president has decided to do is going to come up with a set of executive orders to quickly tackle this. We've put plans in place to have immediate solution to these problems, short-term approach and long-term approach. Yesterday, we had a big meeting. I had a big meeting with the Honorable Minister of Trade and Investment, Trade and Industry, Dr. Doris Anite, on how we're going to structure this executive order. We're going to be meeting with the Attorney General to put all these things in place. And some of those, I don't want to come and preempt the president here, because executive order is a law, but it would help tackle this, and Nigeria will begin to see succor. We'll begin to see the impact quickly, where we're going to have prices of medications coming down, and we're going to have actually these medications being available. But that's just a short-term solution to this. We shouldn't have been in this problem in the first place. If we planned well.
Now, part of that planning would, of course, be health insurance. I mean, there's the National Health Insurance Act that actually stipulates, or makes it mandatory for every Nigerian to have access to health insurance, and of course, any legal resident. What are you doing about that to ensure that truly no Nigerian is left behind as far as the health insurance is concerned?
Beyond health insurance is part of our universal health coverage, where every single Nigerian has access to decent and meaningful health care. Health insurance is one part of it, where if you've been following us at the Ministry of Health lately, we came out with the SWAP programs, sector-wide programming approach, where we're going to now mobilize more funds that our current development partners are spending. We need to align the way we spend with our basic healthcare provision fund, which is 1% of our consolidated revenue fund, which is by law, comes into that basic health provision fund. That has three gateways. One goes to the National Primary Healthcare Development Agency, the other one goes into National Health Insurance Agency, and the other one goes into the blood transfusion, which I'm not going to delve on. You asked about the insurance. So now, with our sector-wide approach, where we're going to now mobilize funds from the development partners with our basic care provision fund, we will have more funds available to provide more coverage via National Insurance Health, National Health Insurance Authority, to millions of more Nigerians. We're moving, and as we continue to do that, we're going to now begin to work on mobilizing more budgetary allocation to that. So the president is very determined that universal healthcare coverage by 2030, Nigeria meets that goal, and we're working assiduously to meet that goal.
Well, it's a fine place for us to leave it. We do hope we'll be having such updates from time to time so that people can follow up with what's happening in the health sector. We'd like to thank you for your time as always, Dr. Alausa.